The study of anatomy requires the learning of a new language. There are tons of different terms that apply to anatomy that help us to describe the overall body and where things happen to be located at. So if we go through some of those terms and talk about some of the basic principles, the first thing to understand is that there is what we call anatomical position. That is the standard human position that we're referring to when we talk about the locations of different structures. So anatomical position is what you see on this slide right here. So you see the front and then also the back. This is basically the normal standing posture, except the big difference that is not particularly comfortable if you were maintaining anatomical position is that notice that the hands are basically facing forward. And we don't tend to stand with our hands facing forward like this. So the arms are held out to the side, down, and the palms are facing forward. That's anatomical position. So if we have anatomical position, based on that, we can talk about a lot of directional terms to identify the location of different body structures. So there are a lot of directional terms. And if we go through those directional terms here, some of them it's easier to talk about them talking about looking straight on at the human body, and then others it's easier if we have a side view to actually look at. So that's why I've got both of these different images here on this slide. So the first directional term to talk about is what we call superior or cranial or as you see cephalad. And so this is going to mean basically towards the head. So we're talking about things that go up towards the head. That would be the direction here. If we're talking about inferior, inferior is basically away from the head. So this would be caudal. So this is basically moving down. So those are two different, caudal versus inferior, or cranial versus superior. Those are really two terms that mean the same thing. Superior is up towards the head, inferior is down, away from the head. Other directional terms, we have anterior versus posterior. Okay, so anterior or ventral is going to be in this direction. So that would be ventral. So kind of on the front side of the body. And then if we're talking about dorsal, dorsal is going to be on the back side of the body. So that would be posterior on the back. So if we were just to section it this way, you've got the ventral part and you've got the dorsal part behind. Other terms, medial. Medial is referring to towards the inside. So we're moving towards that central line that we would have running down our bodies. So medial is going to be like this. Okay, so really moving towards that middle line that we have. Lateral, the other direction. Okay, so medial was moving in. Lateral, we're moving away. Okay, so those are opposites of each other. So if you just look here, we're looking at sets of opposites with these two, and then also with these two here. Intermediate is just like it sounds. We said we've got this central line down the body. We can talk about moving towards the line, that's medial. Away from the line is going to be lateral, and kind of in the middle, which would be right here, that's going to be intermediate. So intermediate is somewhere right in here. That would be your intermediate, or right in here. Okay, so in between the outside and then that center line. Proximal. Proximal means close to the body origin or to the point of attachment. So what we mean by point of attachment would be for our arm. Okay, it's attached right here at the shoulder. So if we're talking about proximal, it would be something that's located more closely towards that particular point of attachment. Proximal is the opposite of distal. Distal is going to be located away from the body's origin or the point of attachment. So again, if we're using the shoulder as an example, proximal would be close to that. Distal is going to be away from that, so moving further down the arm. So the wrist would be distal to the elbow if we're looking at that one. Two other, superficial on the outside. So this would be like our skin. And then we also have deep, which is internal. So things that are underneath the skin. And we can go deeper, that's going more and more towards the inside of the body. Those are directional terms. We also have a large number of regional terms. So Regional terms, as you can see on this slide, there's a bunch of them. Some of these you probably know already, but notice that we have kind of a broad category and then there's lots of smaller categories underneath it. So for example, we've got the cephalic region, which is the head up here, and then we can break that down into many smaller categories. So take some time to go through the terms that you see on here. Definitions are in the textbook so that you can see a formal definition of each one, and try to get these different terms down as far as where they happen to be located at. All right, so if we talk about body planes and sections of the body, and this would also apply to slide sections if you are preparing microscope slides. There are 3 different body planes that are distinguished. So we have the frontal plane. The frontal plane is cutting this direction, so that would separate the ventral from the dorsal back there. Okay, so that's the frontal, or also called the coronal plane. We have the sagittal plane, or the median plane, which is going to cut right down the center here, as you can see in the diagram. That's basically separating right and left from each other. And then we've got the transverse plane, which is going right there and separating, say, at the top of the body from the bottom of the body. So those are the 3 body sections, and that's looking at it sectioning the entire body, but we can also section organs the same way. So if you had an organ sitting upright like this, we can do a frontal section of it. We could do the sagittal, which would be down the middle, so separating the right and the left, and we could also do the transverse, which is going to separate a top and a bottom from that. Review the body planes and sections. Make sure you do understand the difference between them. And then last thing that we have is body cavities. So we do have a number of different body cavities. You can see them colored in this diagram right here. They go into 2 main categories. We've got the dorsal ones, which is going to be the ones that you see in orange right here. Dorsal, running down the back. We've got the cranial cavity. That cranial cavity is going to contain the brain, essentially, and then that's connected to the vertebral cavity, which is going to contain the spinal cord. And both of those cavities are pretty well protected because you do have the cranium that's covering the cranial cavity, and you do have the vertebrae that are containing the spinal cord. So that's they're smaller body cavities really when you them with the ones that we can compare to on the ventral side. So on the front of it, we have basically 3 different cavities that we distinguish. We have the thoracic, which is up in the chest. The rib cage is going to kind of surround that cavity. We have the abdominal cavity, okay, which is in the abdomen, obviously. That is the largest of our body cavities. And then we also have the pelvic cavity, which is going to be down in our pelvis region. There is a muscle called the diaphragm that separates the thoracic cavity from the abdominal cavity. The abdominal cavity is going to be the one that contains the majority of our organs. So we have lots of organs contained in that cavity, and that particular cavity is the one that tends to be the most susceptible to injury because we don't have a rib cage or a cranium or something like that that's directly protecting those particular organs. So if you just feel your stomach, you can feel that it's kind of squishy, and that's the susceptibility of the organs, okay? Because again, there's no bone structure that's specifically covering those up. The pelvic cavity, it does have some protection from the pelvic structure, and we do have certainly some organs that are located in that region. Those are the main large body cavities. There's also some smaller body cavities, and we'll get into those. As far as terms go, so anatomical terms, these cavities, especially the abdominal cavity, they contain a lot, so sometimes it's helpful to have additional terms that help to just kind of divide up the abdominal cavity a little bit more. So with the abdominal cavity, there's a few different approaches to actually dividing that and sectioning it up. One is to divide it into 4 quadrants. And so you can see those 4 quadrants right here on this slide. You can get a general idea of what's kind of in those different quadrants. So we have 2 upper quadrants, a right and a left. We have 2 lower quadrants, a right and a left. So 4 different quadrants. Another system takes this abdominal cavity and it actually divides it into 9 different sections. And so this is going to be more specific. Those 9 sections all have different names to them, and there will be different organs located in those 9 different sections. So without going through and talking about each one of those, you can see them on the diagram here. You can see kind of what organs are fitting into the different sections. So review those. Review what happens to be present in the umbilical region, for example, or in the left lumbar region, if there's something different there. Take a look at these different regions of the abdominal cavity and familiarize yourself with them. Familiarize yourself with which region of the abdominal cavity contains the urinary bladder, for example. Okay, and then last thing is those small body cavities. Small body cavities, so within the cranial region, you have the oral cavity, so that's in the mouth. You have the nasal cavity right behind the nose here. We've got the orbital cavities, which is the eye region, and you can see a few other ones mentioned on here. Some of these are called cavities. They're even smaller ones. We like to use the word sinuses with those. Okay, so these are small body cavities. Make sure that you are familiar with the variety of terms that are used to describe anatomy, because these are terms that we are going to be using. We want to understand those directional terms so that if we say proximal versus distal, you know what we're talking about. Or if we refer to the cranial cavity versus the pelvic cavity, we want to know what that means as well. And then also what type of stuff is actually contained in that particular region.